Sinead, good to have you here. Thanks for coming. Maybe you can tell us a little bit about yourself, about your background. How and when did you decide to become a dentist?
Well, it goes back quite a long time ago. My dad was a dentist, and my childhood was spent working in his dental practice, initially as his dental nurse. So I was 16 working as his dental nurse, and I learned very quickly how to deal with patients in an extremely busy general dental practice in Ireland. And it was a very quick way to learn dentistry and also how to deal with patients at a very young age. So yeah, it was quite the adventure, and it just seemed very logical that I knew so much about it that I moved on into dentistry myself. So it's a little bit of a sad story sometimes when I think about it, because my three brothers are also dentists. We all do the same thing. You could say that we have absolutely no imagination, but we rarely talk about dentistry at home, as it happens. But yeah, we all love our job, and we really, really do get a buzz out of the incredible journey dentistry has been for us. So,
And maybe you can tell us a little bit about your daily life, your day, your how it looks like in your practice.
well, I have a very busy dental practice in a rural town in County Fermanagh in the west of Ireland. It's a small-ish community, so we don't have access to a lot of specialists. So as a dentist who now more or less does mainly implant surgeries, oral surgery, we find that a lot of our general dentistry is being done by my associate dentists, which is fantastic. My main interest, of course, now is really involving surgery, and the journey that has taken me there has been quite a tricky sort of method of getting there, because training in these types of things has never been very straightforward. So our staff meet every morning. We decide what way we're going to spend our day, making ready for any potential difficulties that we might encounter. We all speak to each other. We're all absolutely prepared for how we're going to deal with our patients. And we just have very logical, standardized workflows that allow us to make the day as efficient as it can possibly be. So, and it's a lovely team, and we work together very well, and they're all extremely well-trained staff, and yeah, we have a lovely, happy team. And yeah, it's a constant work in motion, trying to just make sure it's a lovely, friendly environment for our patients to come in.
And your book is going to be published later this year.
That's right.
What will be the topic of your book? Maybe you can tell us some about your key highlights.
Well, it's a book that really encompasses multidisciplinary dentistry. Yes, every case involves implants. Every case will involve implants, but most cases, as we know, never involve just a single tooth space. It's very much a multidisciplinary approach to how we assess and treatment plan. And the book really is about how we standardize our workflows for every patient, every time. And the vast majority of our implant cases also involve, whether it's hygiene, whether it's a functional issue such as tooth wear, whether it's initially an alignment case, which means we have to get our spacing perfect before an implant goes into position. Long gone are the days when we used to just pop an implant into a single space. And even now I look back on cases done more than a decade ago when that's the way we did it, whereas now we have so many tools that we can use to allow ourselves to place implants absolutely correctly within a very solid treatment planning process, making sure basically maximizing our success and predictability for our patients each and every time.
And what is the audience you hope to reach?
Well, I think I'm hoping that dentists who are early out, maybe in the first sort of 10 years of graduation, when they're trying to implement implant surgeries into their, and it's going to be very much a thing of the future. There's no way any dentist will avoid seeing implants, either healthy implants or in the process of failing implants. And I just want to take the scare factor out of it. really, because there is a very logical approach to how we treatment plan these patients, risk assessment for all parts of the implant process, whether it's the tooth wear part, the restorative part, the surgical aspect, high aesthetic cases, and standardizing our approach to how we assess and diagnose, and then ultimately treatment plan and backwards plan our prosthetics, and where exactly the implants will be going based on that person's full face and smile design. So we live in a fantastic time of digital imagery, artificial intelligence, and I use these on a daily basis in the practice. And because of that, all of a sudden, our patient gets the chance to be so much better informed. They get to make their decisions. They almost know where they're going to end up before they begin. And I just love the fact that dentistry has taken us into this era where the patient gets that chance to see so much in advance, and it helps them make their decisions so much more easy for them, because consenting has never been more straightforward for them. They see and they know what they're going to get before they begin. For the young dentist, that's my biggest concern, making sure that they can find their way through, find their mentoring easier, and realize that they can do this in a logical way. And that's what I'm hoping, that I can try and streamline this process and let them see that all of these things are achievable with a very logical, straightforward protocol each and every time. And depending on whether they have to reach out to specialists as a mentor, I think it's there for them. And most, particularly my generation, I think we're so keen to help and to mentor younger dentists who are coming through, because we know how difficult it was ourselves at the time to try and seek that mentorship, which we could never find.
Yeah, you kind of answered my next question already, but maybe you have more advices, or what would you provide for students or young people who consider a career in dentistry?
Well, I think it's so exciting because we find that every single case is a puzzle. I get bored extremely easily, and the puzzle that comes in, the fresh challenge every single day to allow that patient to potentially see a future that they never could have planned before. So every case is a complete puzzle, and putting the pieces together and creating the outcome that gives them that incredible change in their personality, their ability to smile, the fact that they can all of a sudden change their entire personality based on their newfound confidence. I mean, that's the challenge every day. And we have to remember, these patients are number one. They get the chance to absolutely transform their lives, and we are so lucky to be a part of that. And that's the massive aspect of trying to inspire new dentists coming through, that this is the goal, because a happy patient makes a happy dentist, and ultimately that's what it's all about.
That was so nice talking to you. Thank you for your time. It was a pleasure.
Oh, thank you so much. Absolute pleasure.